Next, we're going to talk about some things that you could do to manage your movement in the early postpartum period to minimize aches, pains, and injuries. All right, getting in and out of bed. This is going to be particularly useful if you've had a C-section, so you don't put a lot of tension on that scar. So what this is going to be doing, it's going to be helping you use more of your arms and your body's weight to help you get in and out of bed. So when getting in and out of bed, you never really want to do a sit-up, especially if you've just had a baby or you've had a C-section. So to get into bed, you're going to lay onto one elbow, get this other arm on the bed, lift one leg up, other leg up. Right now you're on your side and you're going to roll onto your back. Having some pillows back here to support you might be beneficial too. To get out of bed, you're going to roll onto your side. So take one leg, roll onto your side. You're going to push up onto one elbow, leg out of bed, and then prop up. This is going to put minimal tension on your scar and abdomen. So as you move further and further away from your delivery date, you might be actually able to do a sit-up. You might still need a little assistance from your arms, but what I want you to really do is focus on this exhalation strategy to help you get out of bed. So we've talked about this before. Full breath in, exhale, lower belly, middle belly, rib cage. That's going to give you that deepest layer of your core turning on and your pelvic floor. So every time you exhale, that's going to give you a little bit more stability, and then you could get up that way. Try not to bulge into your belly when you get up. That's going to put a little bit more pressure on your abdomen and pelvic floor. So that deep exhalation strategy is going to help you brace and then get up a little bit more effectively. Doming or coning is where you're kind of pushing everything into your abdomen, and you might notice more of a bulge forward. So we're going to try to avoid that. We want this exhalation strategy where everything pushes inwards every time we're doing anything that's going to give us a little bit more exertion. Next, we're going to talk about some breastfeeding positions that you're actually able to rest in when you're breastfeeding the baby. I know you're going to spend a lot of time doing this if you do choose to breastfeed, so I want to make sure that you're as comfortable as possible. The major thing here is making sure you're in a resting position. Your spine's relatively neutral, you're looking straight ahead of you, and you're bringing the baby towards your breast. Notice how I use the pillows to bring the baby towards my breast. I'm sitting up nice and tall, and I'm looking straight ahead of me, not at the baby. If possible, you want to avoid positions where you're excessively rounding, excessively cranking your neck towards one side, or excessively leaning forward. For diapering, try to have all the materials right next to you just to make it easier on you. You could try that straddling position, half kneeling, tall kneeling like this, and you can also be kneeling on the ground as so. A changing table is also really good for this just because it's at the appropriate height and it allows you to have a little bit better of a posture. Next, we're going to talk about transitioning from the floor to standing. So this is a good thing to practice. You might not be able to do it right away, but it's a good thing to practice. First, you want to be able to get into this position. So you might want to just practice getting into this position, which you might be already doing with some of your exercises. Next, when you get out of the position, you want to exhale to move into this kneeling position. Bring both legs together. And then you're going to exhale as you lunge out of this kneeling position. So exhale off the ground. Bring your knees together. Exhale as you bring one knee in front. Exhale as you lunge out of the position. When you're carrying baby, I want you to make sure that you're not just kind of resting on your hips like this, kind of coming forward. This can cause a lot of problems, and we're going to try to avoid that. So first things first, let's start off with your feet. So you want to start off with feeling the base of your big toe, base of your little toe, and your heel. This kind of gives you that tripod. Then I want you to go up towards your knees. Make sure you're not excessively hyperextending or locking your knees. Soft knees. Feel your weight kind of shift back a little bit. Relax your shoulders, and you're just trying to stand up nice and tall as you slowly breathe. So we've talked about this breathing before, and I want you to just try to slowly start to incorporate this into your life. Full breath in through your nose. Feel that 360 expansion. Slow, full breath out. So when you're standing, doing any of your everyday activities, your abdominal muscles should be somewhat engaged. So I'm not talking about feeling this really tight squeeze in your core, just a little bit of that lower belly awareness. As you stand up nice and tall, feel your feet, unlock your knees, and feel your weight shift back into your hips. This gives you a nice resting position so you're able to fully function and feel good throughout the day. Also, I want you to avoid just holding your baby on one hip all the time. This is going to cause you to become more reliant on some of these structures on one side versus the other. If you can, switch from time to time so you're getting a little bit more on that other side. And then whenever possible, just go back to somewhat of this neutral position just to give your body a little bit more variety. Likely going to spend a lot of time doing dishes, so I just want to talk about some of the posturing that comes along with doing dishes. So first off, I want you to try to avoid kind of slumping over the sink like this. This is going to cause a lot of extra tension in your back and your neck. Also, I want you to try to avoid resting on your hips like this. What I want you to do, just like we talked about in standing, is really make sure that you feel your feet on the ground. So those 3 points of contact, base of your big toe, base of your little toe, and your heel. I want you to have those soft knees and just stand up as tall as possible if you're able to. So what this is gonna do, it's just gonna give your body a better alignment when you're doing dishes. Also, if you just have a hard time standing up straight for a long period of time because you might get a little tired, you can go ahead and prop one foot on the cabinet below. You're not overly extending your knee. Make sure you're not pushing forward onto this hip. Again, still feel those points of contact, soft knees, a little bit of that belly engagement, and go ahead, do your dishes. This is also a better position to give your baby a bath in. So I would avoid, if you're able to, avoid giving your baby in the bathtub just because you're going to be in this stooped posture for a long period of time, and that can cause, again, a little bit more tension in your back and neck. So doing this at a sink, it's just going to be a little bit better for your alignment and allow you to rest more in this position. And if you need to, you can go ahead and give your baby a sponge bath from time to time just to save your back and neck. Hopefully you found this helpful. I don't expect it to be perfect in any of these things, but these are just some things that you can keep in mind along your postpartum journey, especially if you start to experience aches and pains, because these are going to be the activities that you're doing mostly throughout the day.